HIV is an autoimmune virus which attacks the body's immune system and gradually eliminates the number of T cells present in the body. The elimination of T cells decreases the body's ability to adequately fight off other infections and diseases, and eventually, the body is unable to fight off infections at all. HIV.gov noted that AIDS, or acquired immunodeficiency syndrome, will ultimately result from HIV if left undiagnosed or untreated. There are 3 modes of transmission for the HIV virus to come into contact with a new or undiagnosed individual. These include sexual contact, which is the most common form of HIV transmission, blood or blood products, the second most common, and maternal fetal transmission, third most common. The virus can only be transmitted from individuals who are HIV positive through specific body fluids. These include blood, seminal and pre-seminal fluid, rectal fluids, vaginal fluids, and breast milk. HIV includes 3 stages of clinical infection: acute HIV infection, clinical latency, and AIDS. Once HIV has been diagnosed, it cannot be cured, but fortunately, it can be treated. In 2001, 3 million people died from AIDS. This made it the world's 4th biggest cause of death, behind heart disease, stroke, and acute lower respiratory infection. At the end of 2017, an estimated 36.9 million people in the world were currently living with AIDS. Of those 36.9 million people, an estimated 940,000 people died due to an AIDS-related illness in the same year.
Currently in the world, there are vast differences between the prevalence of HIV and AIDS compared to developing and developed regions. On a global scale, AIDS affects almost all countries of the world. Out of the 36.9 million individuals who are currently living with AIDS, the region with the highest prevalence of this disease is Africa, with an estimated 25.7 million people currently living with AIDS. Nigeria is the most prevalent area for AIDS in the world, with an estimated 3.1 million who are suffering from the infection. In sub-Saharan Africa, approximately 24.7 million people are estimated to be HIV infected, representing about 2/3 of all global HIV infections. Moreover, nearly 1 in 20 adults are infected by HIV, which overall accounts for 69% of all people living with HIV worldwide. In comparison, the World Health Organization estimated in 2019 that in Western Pacific regions, including Australia, there were 1.5 million people who are living with AIDS. In 2017, studies found that in Australia alone, there is approximately 27,545 people living with this disease. ABC News recently reported that in Australia, AIDS is no longer being accredited as a public health issue. Australia, along with other countries, has now overcome the worldwide epidemic of AIDS.
HIV and AIDS is a major threat to development, economic growth, and poverty alleviation in much of Africa. The prospect of HIV and AIDS encompasses many critical issues that inherently determine the identity of the disease. An anonymous survey conducted in South Africa found that out of 420 HIV-positive men and 643 HIV-positive women, around 40% had experienced discrimination which had resulted from suffering from the infection. Likewise, 1 out of 5 lost a job or a place to stay, and more than 1 out of 3 indicated that they felt ashamed, guilty, or dirty due to their infection. Furthermore, according to data taken from the People Living with HIV Stigma Index, in Kenya, 56% of people had been verbally abused, whilst 31% had been physically abused. There is a distinct relationship between poverty and communicable disease epidemics. Besides the human cost, HIV and AIDS is having a profound effect on Africa's economic development and hence its ability to cope with the pandemic. Antiretroviral drugs are a highly effective drug, but is complex to administer, requires medical attention and supervision during usage, but most significantly, it is exceedingly expensive. Those living in developing regions and communities, such as Africa, are most likely to be affected by these complexities, such as the cost of the drugs. Would removing financial barriers in developing regions such as Africa improve the prevalence of HIV and AIDS? Many communities in regions of Africa are disadvantaged by poverty, poor infrastructure, and limited access to basic services. Social factors in South Africa which may increase the prevalence of HIV and AIDS include an increased rate of rape, an inability to enhance their knowledge in relation to sexual activity, as well as an unfavourable position of economy for women. This strongly demonstrates that prevention campaigns regarding HIV and AIDS are less likely to occur, as many South African women have no control over their own protection against HIV infection. As stated by Sousa and Stein, one of the many reasons HIV and AIDS is easily spread throughout Africa is due to cultural norms, including polygamy, having more than one wife or husband at the same time, and wife inheritance. In 2005, just over 14% of all new HIV infections occurred in children aged under 15 years. The vast majority of these infections are acquired through mother-to-child transmission during pregnancy, labour and delivery, or through breastfeeding. Without intervention or treatment, the rate of transmission ranges between 15 and 45% chance of the child receiving the HIV infection from the mother. In 2017, Africa had an estimated 1.3 million pregnant women living with HIV who were in need of antiretroviral drugs to prohibit the mother-to-child transmission of the infection.
Health promotion in regards to the HIV/AIDS pandemic is an area which offers great prospect to continually treat and essentially avoid infection. By the year 2030, the UN-AIDS, the Joint United Nations Programme on HIV/AIDS, aims to have ended the HIV/AIDS epidemic. UN-AIDS aims to execute various implementations, including adequate access to treatment and medications for every individual, prohibiting new infections, and ensuring the protection and promotion of human rights. Is it possible, however, for the AIDS/HIV epidemic to end by 2030 with today's advanced medicine and technology? Alongside a health promotion recommendation to deter the prevalence of HIV, promoting human rights for every individual, whether diagnosed or not. The Sustainable Development Goals are committed to leaving no one behind, addressing stigma, discrimination, gender-related barriers, and barriers which impede appropriate prevention, treatment, and care of HIV, all encompasses the vision of leaving no one behind. UN-AIDS 2019 incorporates many methods and interventions which have proven to be highly effective in protecting against and further reducing the risk of infection. These include male and female condoms, antiretroviral medications, reducing the number of sexual partners, the use of clean and sterilised needles and syringes, ongoing treatment, and sexual education. Ultimately, the region that is most affected by HIV/AIDS is the African region, due to lack of education, resources, sterile equipment, and contraceptive methods such as female and male condoms. Despite HIV being a prominent infection worldwide, certain groups and populations have a disproportionate attribute of being affected by HIV. These groups include people who inject drugs, men who have sex with men, transgender people, sex workers and their clients, and people in prisons and other closed settings. Through HIV testing, an increased diagnosis means individuals are less likely to transmit the disease and are more likely to seek treatment for the infection.